of cerebellum. Now the clinical abnormalities, they are the cerebellar lesion must usually involve one or more of the deeper cerebellar nuclei as well as the cerebellar cortex. Now there can be ataxia. What is ataxia? There is incoordination of movements. There is failure to predict, to maintain the coordination between the motor movements. There is dysmetria. Patients will overshoot the intended targeted movement. There is rebound or intentional tremors there. There is hypotonia. There is dysdiadochokinesia, which is the failure of orderly progression of movement. There is dysarthria. There is failure of orderly progression in vocalization. There is cerebellar nystagmus. There is intentional tremors of the eyes. Now, dysmetria and ataxia. In the absence of cerebellum, the subconscious motor control system cannot predict how far the movement will go, so the movements they overshoot their proposed mark. Then the conscious portion of the brain overcompensates in the opposite direction for subsequent compensatory movement. This is dysmetria, and it results in uncoordinated movements called ataxia. Dysmetria and ataxia can result from lesions in the spinocerebellar tracts because the feedback information from the moving parts of the body to cerebellum is the essential for cerebellar timing of movement termination. Past pointing. A person moves the hand or some other moving part of the body beyond the point of intention. Normally, the cerebellum initiates most of the motor signal that turns off a movement after it is begun. There is dysdiadochokinesia, when the motor control system fails to predict where the different parts of the body will be at a given time. It loses perception of the parts during rapid motor movements. The subsequent movement may begin much too early or much too late, so that no orderly progression of movement can occur. A series of delayed attempted and disorderly movements occurs. Hypotonia, loss of the deep cerebellar nuclei, the dentate and interposed nuclei. They cause decreased tone of the peripheral body musculature on the site of cerebellar lesion. The hypotonia results from loss of cerebellar facilitation of the motor cortex and brain stem motor nuclei by tonic signals from the deep cerebellar nuclei. Dysarthria, there is failure of progression occurs in talking because the formation of words depends on rapid and orderly sequence of individual muscle movements in the larynx, mouth, and respiratory system. There is lack of coordination among these and inability to adjust in advance either the intensity of sound or duration of each successive sound causes disorderly vocalization, with some syllables loud, some weak, some held for long intervals and some held for short intervals, and resultant speech is often incomprehensible. Intentional tremors results from cerebellar overshooting and failure of cerebellar system to damp the motor functions. Then there is cerebellar nystagmus, there is loss of equilibrium, deep reflexes, Tests, they are dysdiadochokinesia, finger-nose test, gait, speech, knee jerk. You can see. Investigations, they are MRI, trauma, abscess, tumor, degenerating disease. So this is all about today's lecture, and thank you very much. Stay blessed and Allah Hafiz.